Hi all. One of my junior asked me two questions about Ringer Lactate. Both the questions actually is part of the myths of anesthesia. One of the question is whether Ringer Lactate is contraindicated in diabetes patient. Well, the answer is no. It is not contraindicated in diabetic patients. In contradiction to the usual hypothesis that the lactate is converted into glucose in the liver by gluconeogenesis will increase the blood glucose level in the serum. However, by the practical studies, the meta-analysis that have been done recently, it is very much clear that there is no significant rise in blood glucose levels if you use Ringer Lactate in diabetes patient. Most of the studies were actually done in the fasting patients that we usually take in operation theater. That further reinforces the fact that the fasting patients, they do not have their blood glucose level increased if they are given Ringer Lactate intraoperatively. Rather, normal saline, if given in excess amount, will lead to hyperchloremic metabolic acidosis, which may be detrimental in those patients. The second question was whether Ringer Lactate should be avoided in patients of sepsis who already have increased serum lactate levels. Now, the point is the sepsis as a pathology is hypoperfusion of the organs because of the vasodilatory state, and that will lead to anaerobic metabolism of the organs and produce more of the lactic acid. This is the reason for lactic acidosis type 1 in the sepsis. The type B lactic acidosis is caused by when the liver or the kidney is not able to excrete the normal lactate in the body. So talking about the type A lactic acidosis only, the perfusion, if improves by resuscitation, whether you give a Ringer Lactate or a normal saline or a plasma light, it will definitely improve the perfusion and will decrease the lactate levels. However, if you use Ringer Lactate, the interpretation from the ABG report will be messy because the lactate in the Ringer Lactate will increase spuriously, show higher levels of lactate. Then you have to check clinically whether the patient has improved or not. You have to correlate factors like perfusion pressure or the pulse pressure variation or SCVO2 and urine output, improvement in tachycardia. All those factors along with lactate has to be interpreted. So yes, the interpretation may be wrong if you are giving Ringer Lactate, but it doesn't mean that it is harming the patient. So you can give moderate amount of Ringer Lactate to the septic patients also. That's all.